There is a silent but overwhelming gender bias in medicine that has basically shut women out of medical research and medical care and has just allowed symptoms to go dismissed for years. This leads to delayed diagnosis, misdiagnosis, delayed treatment, and really dismissing pain or other symptoms as just stress or in the woman's head. We have to acknowledge that there is a gender bias in medicine. Ignoring it is not going to make it change anytime soon. Welcome to Baby or Bust. I'm your host, Dr. Lora Shahine, and I am tired of infertility and miscarriage being misunderstood, hidden, and full of stigma. Welcome to the podcast with interviews and in-depth discussions on topics all things fertility. Thank you to our friends at Seattle Sperm Bank and Greg Moga for sponsoring the show. Please take a moment to give us a 5-star review anywhere you listen to your podcast. It really helps other people find the podcast, and it just means so much. The Retrievals Podcast by the New York Times and Serial Network shed light on a horrifying story about pain during procedures at a fertility clinic in the United States. It's estimated that over 200 women had egg retrievals without pain medication because a nurse was switching out fentanyl for her own use. This is awful in and of itself, but this is more than a story of one clinic. It represents an ongoing problem with dismissing women's symptoms in medicine, and we need to talk about it. It's hard for me to learn about and discuss this situation. Obviously not as difficult as being one of the women in pain and feeling dismissed by their medical team when they tried to ask for help. But as a fertility doctor doing egg retrievals, and as a former fertility patient who had an egg retrieval myself, as well as other fertility-related procedures, it's awful to hear about people in pain. It would be easier to ignore and just hear this shocking story and move on with our lives. It'd be easy for me to reassure my own patients that what happened to the women interviewed for the Retrievals podcast will not happen to them in my clinic in Pacific Northwest Fertility in Seattle. But that's not enough. This is a bigger issue than one clinic. Dismissing women's symptoms is an epidemic, and the only way to stop it is if we talk about it and refuse to let it keep happening. So here we go. So first of all, the story, what happened at this fertility clinic. So my sources are listening to the podcast itself, as well as journal articles that are out there and listening to interviews. So my sources are public and they can be found by anyone. I do not have any personal knowledge of what happened at the clinic, but I can share with you what's out there and public knowledge. So the story is that a nurse in a fertility clinic was switching out fentanyl vials with normal saline so that when women at the clinic were getting their egg retrievals and procedures that can be painful, everyone in the clinic, including the patients, thought they were getting fentanyl through their IV, but they were just getting normal saline.
They started the procedure and, I was just sort of taken by surprise, not expecting the excruciating pain, and just letting them know that, I don't think the pain medication is doing anything. It really feels like you're stabbing the needle.
So these women were complaining of pain because they were not getting a medication, but afterwards they felt like they weren't listened to and they felt like their symptoms and feelings of pain were dismissed.
I remember thrusting my hips up saying, I feel everything. And nobody believed me. And it's just I don't know. But what are you going to do? I wanted the procedure done. I just let it happen. And I was I'm awake. So.
In the podcast, one of the first interviews is a woman describing what she expected to receive. She was told that in the retrieval, she would receive 2 medications, fentanyl and midazolam. So fentanyl is an opioid. You have probably heard of fentanyl. It's in a lot of headlines lately with the opioid crisis. Fentanyl is an analgesic. It's a pain medication. It helps you not feel pain. It is 50 times more potent than morphine. It can come in many forms, but it's used in a OR setting or a surgical setting in a liquid form in order to give it in an IV to help people have less pain during their procedure. Midazolam is a benzodiazepine. It's a little bit like Xanax and Valium are also benzodiazepines, but midazolam can be used in a medical setting to help somebody be more sedated, less anxious. So fentanyl also has a little bit of sedating properties as well. And together, fentanyl really helps control the pain, and the midazolam helps people feel a little bit more relaxed, less anxious, and a little bit more sedated. So together, if someone has only fentanyl and midazolam, they might still be a little bit awake and kind of aware of their settings, but they shouldn't be in too much pain and they should be relaxed. So not completely asleep, but not in so much pain. So again, I do not work at Yale. I was not in the OR when this happened, but if you listen to the patients in their interviews, they talk about feeling so much pain during their retrieval and just beyond what they expected.
I was just sort of taken by surprise, not expecting the excruciating pain. My blood pressure started going up. I was sweating profusely and telling them I was just in too much pain, that they had to stop. At that point, I remember them giving me more of the pain medication and me saying, it's not making a difference.
I remember yelling or kind of making and really looking in confusion at my nurse, the attending nurse, and her saying, I'm giving you the most I can legally give you.
She said that that's the maximum that she's allowed to give me, so she couldn't give me anything else.
At one point, they did say that I had maxed out. I couldn't have any more fentanyl or Versed. And I was like, how is this possible?
How is that even, how am I feeling this?
How do people go through this?
So it's important to have pain control during an egg retrieval. An egg retrieval is a part of the IVF process in which the eggs are extracted from the body. So the ovaries are sitting right at the top of the vagina. The eggs are inside fluid-filled structures within the ovaries. And so the way the procedure is done is a vaginal ultrasound is placed in the vagina, and there's a little needle guide at the end of the vaginal probe, and that goes right in through the upper wall of the vagina, right into the ovary, because the ovary is sitting right there. And then you drain all the follicles, because with the follicular fluid, the eggs come out. So it's kind of one puncture on one side, drain all the follicles in the right ovary, do the same thing on the left ovary, and you're done. So the procedure should be relatively quick. It should be 15 or 20 minutes. And if people aren't completely asleep, they shouldn't be in so much pain. And fentanyl is something that if somebody is in pain, you should be able to give them a little bit more to help them feel a little bit better during the procedure. But that is not what the women describe in the podcast. They talk about feeling poked. They feel like their insides are being ripped out. I'm sorry, I know that's triggering. You should listen to them. You should listen to their own words. They feel like people were trying to comfort them in the operating room. They felt like the nurses cared and the anesthesiologists were trying to give them more medication, but that they still were just not feeling any different, even though they were being told that they were getting strong opioid medications that should have made them have less pain.
The egg retrieval, they kind of do them one by one or a couple at a time, my impression. And so you have moments in between pain to say, what the fuck is going on?
I do remember, I think I swore. I was using curse words because it was just so painful.
I don't know if I can do this any longer.
You just have to get through it. It's going to be over before you know it.
Okay, this is going to be over eventually.
You can do this. You can do this.
I want this moment to be over.
Get through it. Get through it. Give me.
At one point, they did say that I had maxed out. I couldn't have any more fentanyl or Versed. And I was like, how is this possible?
How is that even, how am I feeling this?
How do people go through this?
I can feel that. I could feel I don't even know how to describe that. You can just feel them inside of there. As a woman, we've all been through things, with those kind of doctors and stuff. But this is just a pain. It's hard to even explain what it felt like.
So it's estimated that this was occurring about 5 months in the year 2020, that this nurse was switching out the fentanyl with normal saline. And even though there's about 11 patients that are involved in the lawsuit and really sharing their story in the podcast, It's estimated that could be 200 women that were affected by this switching of fentanyl and normal saline. So listen to the podcast to hear exactly what the women describe, because it's their story. But let's talk about what pain control typically is like for an IVF retrieval. I can speak to the pain control that I provide my own patients at Pacific Northwest Fertility in Seattle, and I can speak to my own experience of having an egg retrieval. In my clinic, pain control is personalized for each patient, but it's a little bit different than what's described in what happened at Yale. In my clinic, most patients receive Propofol and a little bit of fentanyl. So we've already talked about fentanyl. It is an excellent pain medication and opioid to help decrease pain. But instead of Midazolam, we typically give our patients Propofol because this will really help them go to sleep. Propofol is a non-barbiturate intravenous sedative that is used in a medical setting to help people go into a deep sleep, where I talk to my patients, you are going to take an amazing 15-minute nap. You're going to go completely asleep. You're not going to remember anything. You're not going to feel anything. And then you're going to wake up in the recovery room and you might feel a little achy. You might have a little bit of spotting, but you're not going to actually remember the retrieval itself. Now, Propofol got pretty famous. You might have heard about it, involved with Michael Jackson's death, and it was really in the headlines there. And so it kind of has a little bit of a negative connotation, but it is an amazing medication in a setting because it helps people just be completely comfortable and it wears off really quickly. So the Propofol helps them go to sleep for the procedure. And then when they wake up, they've got a little bit of fentanyl on board in case they're having a little bit of pain. Then it's helping to treat them and help them wake up in a really comfortable fashion. I can't speak for every IVF clinic in the United States, but I can say that the clinics that I've been involved in used both Propofol and a little bit of fentanyl. And I feel like, talking to my friends, that that's pretty common. I can tell you that's what I received for my own egg retrieval over 10 years ago. Oh my gosh, maybe 14 years ago. I do not remember my egg retrieval at all. I went to sleep and I woke up and I was in the recovery room. I actually felt pretty good. I was so fortunate. I didn't felt a little bloating and a little discomfort, but I did not wake up in pain. I did not wake up during the procedure or feel it, but that was my personal experience. So the next thing I want to talk about is, where did this come from? This history of not listening to women. Yes, an important part of this podcast is shedding light on the nurse that switched out the pain medication and the fact that people had a painful medical procedure without pain control. But another big piece of this is just medicine not listening to women. So you'll hear the patients talk about how they were, even in the procedure, they were saying, listen, I'm not feeling any relief from what you're giving me. Or after the procedure, trying to speak to their healthcare team and saying, like, listen, that was not what I expected. It's reflective in not even exactly what happened in this particular medical setting, but just medicine and just the world in general. Just pain is often dismissed for women.
And my nurse was there. And I remember her saying, I think it was so painful because we got so many eggs. And so it was just sort of this like positive kind of false narrative about what had happened. And so then, I think I coped by coming up with an alternate explanation, which was that I do remember waking up during having my wisdom teeth being pulled when I was a kid, to the nurse saying, shit, and then, giving me more drugs, putting me back under. So, the other explanation for me was that maybe I'm not sensitive to certain opiates, and I remember also that kind of became my narrative with, my friends and colleagues kind of remember me sort of switching to that narrative and saying like, well, maybe you're not sensitive to fentanyl. So I started to kind of tell myself a story about my pain, just try to understand, it's a way of just understanding my experience and thinking, yeah, maybe this is what happened.
There is a silent but overwhelming gender bias in medicine that has basically shut women out of medical research and medical care and has just allowed symptoms to go dismissed for years. A perfect example in my own area of specialty is it can take 7 to 8 years for a woman to go from symptoms to a diagnosis and adequate treatment for endometriosis. Endometriosis is an inflammatory condition associated with painful periods, pain with intercourse, and infertility. And it's a difficult thing to diagnose because you can only diagnose it by actually seeing lesions inside the belly. So it does take a laparoscopy to adequately diagnose it. But people talk about their symptoms being dismissed for years as, oh, menstrual cycles are supposed to be painful. And just this years and years of affecting their personal lives, their ability to go to school, their ability to work because their pain wasn't adequately being treated because the diagnosis wasn't there because no one was listening to their symptoms. And there's other examples of this in medicine. You know, women often get misdiagnosed for a heart attack because they go to the emergency room with chest pain or other symptoms, and it gets dismissed as a panic attack, and they don't even get a workup to figure out if it is an actual heart attack. So why is it like this? Why does this keep happening? Well, if you'd like an excellent resource and a deep dive into this topic and goes into the history and the why and the philosophy, it's a wonderful book called Doing Harm by Maya Dusenbery. She's a journalist who struggled with her own symptoms of pain and years of trying to figure out what was going on, finally being diagnosed with rheumatoid arthritis and getting the pain relief that she needed. And she started reflecting on it and that it's not just autoimmune issues or endometriosis or other things. There's really a systematic, overwhelming gender bias in medicine that has led to poor care in women's health and this overwhelming distrust of women of the medical field. And in her book, she talks about 2 big reasons: a knowledge gap and a trust gap. So the knowledge gap comes from women have honestly been excluded from medical trials for decades. It was considered more difficult to include women in trials. So a lot of medical trials would just be based on men because they were easier to study. You didn't have to worry if the women were going to get pregnant or not. You didn't have to worry about the menstrual cycles and hormone fluctuations. They were worried about too many variables between the sexes. And so let's just exclude women from the trial so we can get a clean read on this intervention. And then you're just sort of assuming that women's bodies are exactly like men's, okay? The knowledge gap is also from a lack of education. So in medical school and residency, very little time being dedicated to understanding the menstrual cycle, understanding reproductive health as far as women. And honestly, that's the same thing for reproductive health for men as well. But this knowledge gap is not only like a lack of research and studies, but it's a lack of teaching and knowledge. And finally, a lack of investment to researching specific diseases that affect women, more than men, something like polycystic ovarian syndrome, endometriosis, and a lot of autoimmune issues that mainly affect women. There's just not a lot of money going into studying these issues. So that's the knowledge gap. The trust gap comes from doctors and healthcare providers just not trusting women when they say their symptoms. This leads to delayed diagnosis, misdiagnosis, delayed treatment, and really dismissing pain or other symptoms as just stress or in the woman's head. So these 2 gaps, this knowledge gap and this trust gap, are intertwined. It's hard to piece them apart. So if you don't learn about women's health and you didn't study it and there's no research into these particular diseases, you're not going to necessarily hear and know how to diagnose and treat them. So is it that women's symptoms are being dismissed or ignored because the doctors lack knowledge and research in these particular issues? Or is it because they don't trust women and they kind of think that the symptoms must not be real? It's intertwined. So what can be done about that? Well, listen, number 1, we have to acknowledge that there is a gender bias in medicine. Ignoring it is not going to make it change anytime soon. Number 2, we can encourage lawmakers and scientists to study diseases that happen in women and include women in clinical trials. And number 3, we can trust women's symptoms. Let's assume that it's real and prove that it's not. not assume that it's not real and not even do an evaluation. So I really do strongly encourage you to read that book if you'd like to learn a little bit more on that. I basically just gave you the Cliff Notes version, but the author did an amazing job. So how can you advocate for your care to make sure that you get the compassionate, evidence-based, and excellent medical care that you deserve? So I've got 6 tips here. Ready? Number 1, trust yourself. Don't shame yourself away from symptoms. Don't blow off painful menstrual cycles that don't allow you to go to school or causing you to miss things that you enjoy in life. That's not normal. Trust your own symptoms so you can advocate for your care. Tip number 2, take charge of your own care. Part of this is keeping track of your own medical records. I know we have electronic medical records, but hospitals don't communicate very well. Clinics don't communicate very well. So just keep track of your own blood tests and tests and doctor's visits and recommendations. And also, when you go to see a doctor, take your list of prescription medications and supplements that you're taking with you and take a list of allergies. So you're not spending time with the doctor trying to remember what medications you're taking. That is precious time to be able to ask your questions. So just remember and take kind of lists of things so you don't have to spend precious time talking about that. You've got that information ready to go. Tip number 3, write your questions down so you don't forget them. And when you are getting answers, write down the answers and also consider bringing a partner or a friend to your visit because 4 ears are better than 2. Tip number 4, ask why. If a doctor doesn't want to do tests that you've read about, like ask why. If they do want to do tests, ask why. What are they expecting to find? How is it going to help them with their diagnosis? If there's a treatment, ask, hey, what are alternatives? And why are you thinking that this one is the best? Just ask why. Tip number 5, look for red flags in your doctor. If you feel dismissed, if you feel that that person is not listening to you and you don't feel heard, pay attention to that feeling. Because tip number 6 is get a second opinion. So if you don't feel heard, if you feel dismissed, that person won't answer your why questions about your own health, get a second opinion. Keep asking, find someone that will listen to you. So let's recap. We were reflecting on this podcast, The Retrievals, that tells the story in a fertility clinic of women not getting pain control for their egg retrievals because a nurse there was switching out fentanyl with normal saline. We were reflecting on typical pain control for egg retrievals and how it can differ from clinic to clinic, but what medications are used and what you could expect at your retrieval. And I hope learning that will help you ask more questions before your own experience. Number 3, we were reflecting on why we got here, why these patients felt so dismissed. Not only was it horrible that this happened to them, but when they were trying to seek help and trying to figure it out, they felt like their pain was dismissed. There is a deep gender bias that we have got to understand in medicine. That is part of making sure that this doesn't happen again. And number 4, I hope the tips that learning how to advocate for your own care will help you feel more confident when you have interactions with your healthcare provider and help you find someone that's going to listen to you, respect you, and not dismiss your symptoms. The fertility story this week is about the patient that told me about the Retrievals podcast. When I'm counseling patients about IVF and considering that option for people for fertility care, I always ask the question, what makes you nervous about IVF, other than everything? I often hear about fear of needles, fear that the IVF cycle will not work, fear that they're never going to be the parent that they dream of. But one patient said to me, I'm scared that I'm going to have pain with my retrieval and that you won't care. That stopped me in my tracks. She's the first person to tell me about the Retrievals podcast. That day, I was honest with her and said I hadn't heard the podcast yet, but I explained to her how patients are put to sleep at my clinic. They don't feel anything, they don't remember anything, their pain is very well controlled and taken care of, and I explained the medication that we give afterwards if they wake up and they have pain, and even support available to them, not just in the recovery in the clinic, but ongoing. Like there's a doctor on call 24 hours a day to call and answer questions. This patient is still in treatment and she's getting ready for her embryo transfer now, but I appreciate her telling me about this podcast and not feeling ashamed or worried that as a doctor I was going to dismiss her vulnerability. Many other patients have reached out since then, and I can now share with them exactly what we've learned from this podcast. I really appreciate her being honest because I could address her fears and help her feel confident moving forward with her care. Talk to your team about your fears and how they can be addressed. IVF and family building is more than the appointments. It's more than the medications and the outcome of the embryo transfer. Find that support that you need and advocate for your care. That is one of my goals with this podcast. We are here to educate you and to help you have the best care for your family building journey. You can find this episode and all others at my website, drlorashahine.com. Other resources there are links to my YouTube channel, Instagram, TikTok. I just love educating. Please share your own fertility story and topics you'd like to learn about. Send us an email to hello@drlorashahine.com. Thank you to my producer, Shannon Perry, and her wonderful team at Audiotocracy. This is your host, Dr. Lora Shahine. See you next week when we talk to Lynn Jensen all about yoga and fertility. Until then, wishing you love, luck, and pineapples.